Episode 85, Skincare Hints for Looking Younger.
BioBalance HealthCast features conversations about positive aging, covering treatment and solutions that include bioidentical hormone pellet therapy, safe and affordable skin rejuvenation, and spa-quality botanical skincare. Your hosts are Dr. Kathy Maupin, Medical Director of BioBalance Health and a leading expert in treating symptoms of aging, and Brett Newcomb, a licensed professional counselor.
Today, we're talking about anti-aging products and services that are available at BioBalance Health, and in particular, we're going to focus on skincare.
That's right, and this is we're also talking generically about the different types of skincare that are available at medical spas.
Okay.
Because most people are very confused about that. Mm-hmm. So first we'll talk about the aging of the skin.
Can we talk about a medical spa as opposed to just a spa?
Yes.
I mean, what is the difference? Because that's terminology that you use, and I'm not sure that I know what it means.
Well, medical spas have a medical director who's a doctor. Okay? So that's the first thing. We can use, and we have a medical spa, so we can use pain medicine if necessary, injections to numb you if necessary to do a laser procedure. We can use Valium if you were going to have a laser procedure that was painful. We don't do smart lipo, but smart lipo is done in the office, usually by plastic surgeons, sometimes by other folks who are skilled in it. But
and smart lipo is?
Smart lipo is liposuction through a teeny tiny little cannula, like you would do your chin, or you do small areas, back fat.
Right, so they like a vacuum cleaner.
Like
they
a
suck
vacuum
out
cleaner.
The fat.
Yes.
But that's painful. Or not,
but they give you Valium,
so they can give
because they're in a doctor's office. They can give you Valium for that and some pain medicine, and they inject lidocaine, and then they use a specific laser to go in and break up the fat. And then they suction it out, but it's with a very tiny little tube, a tiny cannula. So that's done in a medical spa. It can only be done in a medical spa because you have to have a medical director to do that.
Right.
And then there's some lasers that absolutely positively require a physician, the kind that are ablative, the kind that the physician doesn't have to do it, but they have to be directly supervising the nurse practitioner or the nurse that does it. And those lasers actually take the top layer of skin off. So they exfoliate, they take all the dead skin off and also some living skin to give you a new fresh look. We call it resurfacing. And that has to be done in a doctor's office. Now, the other thing is...
I think of roads when you say resurfacing.
Yeah, I know. It is kind of like road maps. We're taking the road maps off.
Yeah.
All the places you've
all
been.
All the mileage marks on you.
All the places you've been and all the fun times you've had are on your face. So we're just kind of cleaning that out so no one has to really look at your history or know how old you are. So actually what we're talking about today is the appearance of youth and how to regain it. And what is that? Because lots of people come in and go, well, I don't know what I need.
Right.
I don't know what it is that will make me look younger. And so sometimes you have to know the basics so that when you go into a physician's office or a cosmeceutical medical spa, you can go in and say, well, I don't like this because it makes me look old. But they should also be able to tell you by looking at you and evaluating your skin that they can do this, 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 and this to make you look younger. You don't actually have to understand why those things make you look younger, but they do make you look younger. That's the whole goal in all of this.
And looking younger is a value because?
Because we all want to look younger because it's attractive to look younger. In our society, it's attractive to be less than 50. And so we want to bring our age always back to a younger age. We're not talking about what you look like. I'm not talking about how you feel. It's healthier to be the same, like what we're talking about with hormones, to be younger in your hormonal age. It's healthier to have all your hormones replaced and have all your hormones back. That keeps the inside of your body young. But we're talking also about today, talking about the outside of your body.
Right.
And that requires not only being healthy and replacing hormones and giving up smoking and modifying your drinking, it also requires you to do something to the largest organ of your body, which is your skin, and change that because you maintain a lot of the sun damage and wrinkles from thinking or concentrating or being angry. Yeah, that kind of thing. And then gravity. Gravity pulls everything down. So the more years you live, the more droop you have because you've been fighting gravity all this time. So I think the reason we want to look young is because that's valued in our society. It's considered attractive. Everybody looks at youth as a goal.
You know, that's a sociocultural message, and we're heavily marketed in the United States and in Western culture for looking a certain way, for radiating a level of energy or strength or youth or wealth or whatever. There are a lot of products that help you do that. But there's also a larger message there, and the larger message is not just sociocultural, it's physiological. If you look better and feel better, then you perform better.
Yes.
And there are quality of life issues. It's kind of like driving an old car that you never wash and never clean out. I mean, and, you know, people get depressed. It looks awful. Their energy levels are low. Sometimes you wash the car, you polish it, you put wax on it, you clean it up, and you come out and you look at it and you think, oh, that looks nice, and you're proud to drive it. And that pride radiates a message that other people pick up. You know, Malcolm Gladwell wrote a book called Blink.
Yeah.
And he talks about how we make synaptic decisions from disparate little pieces of information or fact or perception that come in, and instantaneously we know something.
That's the first impression.
Yes. And so part of what you're talking about is when I walk into a room and people know me or don't know me, they look at me and they make one of those blink assessments, one of those synaptic assessments about my energy level, my youth, my contribution potential to a relationship or a conversation or anything else. And so it is in my best interest to have that snap judgment be as positive as I can have it be.
And there's being young, and then there's being young is good for some things, but like being a doctor, I used to try to look older because everybody said, you're going to do what to me?
Yes.
And you're going to do surgery?
Oh, yeah.
Or you're delivering my baby? I had one woman's mother follow me down the hall as I took her to C-section, screaming, how old are you? How many of these have you done?
Yes.
And I was 35.
Oh, yeah.
I mean, I was plenty old. I had been in residency, medical school, and I was in private practice, and I had done thousands of C-sections, and she thought I was just a little kid.
I used to have the same conversation with my students at the university that were going to go into counseling careers, and so many of them were in their mid-20s, early 30s. And I would say to them, you're going to have the knowledge, you're going to have the skills when you graduate from this program, but you aren't going to have the mileage.
Right.
And you need to look as if you have the mileage if you want people to come and talk to you.
And to believe you, because it makes you believable to be above a certain age, but we don't want to be higher than, say, 50. I'd say 50 is probably the cutoff now. We don't want to look older than 50, and we don't want to look younger than 30. So there's this sweet spot.
So there's a visual age plateau. It's not a chronological age plateau, but there's a visual age plateau that sort of maximizes your credibility and your acceptability. And if you're professional, your professionalism and all of that sort of stuff. When you're younger, you're pushing to look older, so that you can get in a bar and drink and maybe not be carded.
But the minute you get to 21, you want to be younger again,
yeah, oh
somehow.
Yeah. And you want to freeze frame it and stay in that plateau. And so many of us have lived lives of distress and consumption and pressure and adventures. We've smoked, we've had problems with obesity, we've had problems with work injuries, we've been out in the sun. I was raised in the South before anybody ever heard ultraviolet rays.
And I was raised with iodine and baby oil all over when I was outside.
Yeah.
And I thought, oh, I have dark skin. I'm never going to get brown spots.
Yes.
I can't tell you how many thousands of brown spots I've had lasered off of me.
Yeah.
But because that makes you look old. And
Mottled.
that makes you look unkempt. It makes you look not clean when you have brown spots on your skin. So that's one of the things that we'll talk about when we talk about specific lasers that can get rid of that.
Okay.
But what we want to actually suggest is for people to decide what they want to look like before they go to the doctor and get an evaluation. And it doesn't always take a facelift. In fact, it shouldn't take a facelift until you've you've gone through all of these other things.
I was thinking Brad Pitt was how I would want to look.
Yeah, well, I'm sure that's
If I had enough money.
But
I mean, to be 75, I'm not bad.
But you want to look. you want to look like you. I mean, I always suggest to my patients that when they first come in, they come in for a skin evaluation with our Visia machine, and so they put their face in, and we do pictures of their skin, and the damage is then registered in pictures and described about how much damage they have compared to people their own age and then compared to people who are youthful.
When you say you do pictures, the computer program applies certain filters to pull out information like a specific segment of your skin that would have pigmentation problems or discoloration problems or injury problems or scar tissue, wrinkles.
Right, it shows all of those things, and then little blood vessels that we get as we get older and things like that. Each thing is shown on this picture. And then my esthetician and my nurse practitioner sit down with my patients, and they go through what I would go through if I were doing it, and that is, here's the problem. These are the problems that you have with your face, and what are you most interested in? Because a lot of people are more interested in brown spots. Some people don't even see the brown spots and they want their wrinkles taken care of. Some people have kind of a drooping eyebrows, so they look really tired. And so we have to address that because that's what they're concerned about. But what my estheticians and nurses do is they prioritize. What's the thing that bothers you the most? And then how do we take care of all these other things to bring your skin back to square one? Healthy, because we're going to get rid of brown spots, which are usually precancerous. And young looking and hydrated looking. How do we do that? And so there are steps for each individual, and an individual plan that we make for patients. And that's what should be done, but we don't want to make you look like somebody else. We want to make you look like you did in your 30s. So I usually have people bring a picture of what they look like in their 30s, and then we can actually do a better perspective of where we want to go with this, because you can't tell somebody had really high cheeks in their 30s if you don't do that for them, if you don't refill their cheeks.
So gravity creates the jowls and it all drops down.
Right, and you lose the flesh underneath your cheeks. So what we have to do is raise the cheeks by filling them up. If someone had cheeks like that and they don't have them now, they won't look like themselves at the high school reunion or the college reunion. People won't recognize them. So sometimes that has to do with weight, but I'm talking about people who have gotten healthier, gotten to a fairly decent weight, and now we're talking about actual skin on their face, which is the most important because it's always out there and that's how people judge you. And then you can go to everything else. So we start with evaluation, prioritizing treatments, deciding on what's most important to you, and looking at what you used to look like and what you look like today, and pointing out each thing that looks different, that makes you look subconsciously old to other people, and then trying to help you fix that. It's hard, some clinics and spas go, well, what do you want? Well, you don't know what you want until you know what aging does to your face. And I've learned a lot more about how to determine that and what aging really does by having the medical spa and being on a board of a different medical spa.
So with this Visia machine that does the facial analysis, do you have the ability to sit down with the computer then and say, okay, if we did something about the vermilion line on your lips, such as this, and then you show it so they can see what they would look like before it's done?
No, we don't have that.
You don't have that?
We don't have that. That's a 3D program that the plastic surgeons use because the patient's under anesthesia, and so they need to see what they're going to look like. Now, we do things incrementally, one treatment at a time. So we can do one treatment, and they can say, well, I like that, but I don't like this, and then we can change it. So we usually have a series of treatments for each laser, or a series of treatments for each skin, like hydrofacials. We do a jet peel that gets rid of all of the dead skin on your face, and then it hydrates your face, so it plumps up everything. That's a younger look. Plumping up your face and getting hydrated is what looks younger to everyone else. And it fills in some of the wrinkles. It's not permanent. That's kind of one of those you have to do it every month, things kind of like what we used to do with dermabrasion. But it doesn't do what dermabrasion did. Dermabrasion would just take your skin off, live and dead, and it would leave you really red and real
2 or 3
angry
days,
for a
yeah.
while.
Mm-hmm.
But if you do it with water, with saline, the jet peel leaves you smooth and exfoliated, dead skin gone, but the living skin has then been hydrated and it makes you look fresh and nice and plumped up.
And hydration is a really important asset to the way that you look. Going back
It
to
is.
the blink thing. And
Yes.
people that are dried and desiccated, people that have smoked themselves. I mean, they look like a side of bacon because their skin has been smoked. Look horrible. They look old and tired. Even if they're not, they look that way.
But do you know why that is?
No?
That's because when you smoke, you are actually inhaling carbon monoxide. Carbon monoxide binds to your red cells, and you can't get oxygen anymore to your tissues. So you're in a state of hypoxia. No oxygen means you can't repair your cells. Your cells are not metabolizing properly. Then your skin is like the last place your body wants to bring oxygen because there's more vital structures
Right.
beneath.
Right.
So your skin is really deprived, and that's what makes smokers look like they're much older than they are. They have deeper creases. They have a lot more
Their skin's
hanging
all dried out.
skin
Yeah.
because they've been hypoxic. They have no oxygen. Oxygen's big. You need that.
Yeah.
And that's what keeps you looking younger is good vascularization and good
I was
oxygen.
talking to a friend of mine a few days ago who's probably in her mid-40s and has been a smoker since she was 13. And walked up in the conversation thinking, my God, she looks really old and
What happened?
worn out.
Yeah. Is she sick?
And she's not. I mean, she's vibrant. She's got a lot of energy, but she doesn't. It goes back to that whole perceptual experience of her as looking old and tired. And if she, depending on her
we
career
wanna look
path,
at
if
youth
she was
and-
in sales, if she was single and marketing herself out in the community,
Yeah.
there are reasons of legitimate concern, and not just vanity, for trying to look your best.
I think we're more confident when we feel good about what we look like, what we're wearing, how our hair is done. I mean, if there's roots showing, I might as well just not leave the house. It's like, oh, don't look at me. Do I have a hat? That takes away my self-confidence.
But it matters where you go and what you get. Because
Yeah, it does.
there are people out there that sell things and that perform services. You were talking about eyes and the wrinkles and stuff around the eyes. And I know a couple of people that have had plastic surgery and their eyebrows are locked up in a constant state of surprise. And no matter what's going on, they can't change that. And
That's right.
You look at them and it's like, oh my God. And my wife will nudge me and go, why don't they know? Well, they probably know,
They
but
know.
it's been done. So then what?
Yeah, then what? There's not much you can do about that after it's
so-
been done. So the person you choose to do a facelift is more important than
Yeah.
any other body sculpting because that's really complicated and the better the surgeon, the better the outcome.
Sure.
And they'll advise you not to do certain things if they think it's going to make you, the good ones, they think it's going to make you look worse. So
Yeah, your
a
ears
really
go up
good
4 inches on
surgeon-
top of your head.
really good plastic surgeon will say, you're either going to have, like if you do a brow lift, you could have a scar all the way across here, and that would not do that to your eyebrows. Okay, I just learned this from a plastic surgeon who was taking care of one of my patients. He said, if you put a line here to actually help the forehead lift, but that won't bother your eyebrows. But if you take the forehead and you move it
Just
up
pull it
here
up, yeah.
and you put the stitches back here,
Right.
then your eyebrows may, not always,
Right.
may be hyper elevated and you'll always look like you're surprised.
Yeah, deer in the headlights.
And it's not good for anyone to be able to perceive that you had a facelift. It's better.
You know, the goal would be to avoid that.
The whole deal is illusion. It's the illusion of youth, not, oh, they had a facelift so they're trying to look young. That takes away all the benefit of looking young.
But you're not a plastic surgeon,
I'm
and that's
not.
an extreme procedure, an
That's
advanced
the end-
procedure.
that's the end
What
point.
you were saying is that when people come to you, they can cherry pick what they want to do, see how it works, adjust or modify that or discontinue it, and then move to the next thing that they want to do. The question I have is, is all that affordable? Are we talking about extreme high-end cost? Or are we talking about something that somebody who's willing to do what it is necessary to take care of themselves can afford?
In general, it's fairly expensive, but people spend a lot of money on clothes and shoes.
Mm-hmm.
But the clothes and shoes don't go with you everywhere you go, and they wear out and go out of style. But your face goes with you everywhere.
Kind of like lipstick on a pig.
Absolutely.
To quote Sarah Palin.
Yes.
Yeah.
However, I rarely quote Sarah Palin. But you got me just totally off.
I'm sorry.
Off
We were talking about the cost factor and making decisions.
Lipstick on a pig.
Well,
Okay.
my wife has taught me it's penny wise, pound foolish. When she and I first met, I was buying $4 pair of slacks at JCPenney, and they'd wear out in a month.
Yeah.
And she's like, that is not the way you buy clothes.
Right.
You get what you pay for quality, and quality lasts. And this is the same thing that you're talking about.
Right. And Botox is the best example I've got, because lots of people do Botox, okay? But you have to have the right person do your Botox, or your eyebrows are going to be like this for 3 months. Everybody will know you had Botox. That's not the key. Is let no one know you had Botox.
Exactly.
And then remove the tiredness from your eyes, and so that everybody thinks, oh, doesn't she look rested? Doesn't she look refreshed and happy? And everything seems to be going well for her. That's what you want somebody to say, not, oh, too much Botox, can't smile. That's the key. The key is not for anyone to know. I don't mean you have to keep it a secret, but no one who's a stranger should look at you and think you have Botox.
Yeah, you want to walk by and have somebody go, who was that masked man?
I have an amazing nurse practitioner injector, Jenny, and she worked in LA. She worked with plastic surgeons there doing injections, and she also does radius that gives you your cheeks back, and she also fills in these lines with Juvederm, and lips that, here's what it takes to look young. It takes fuller lips, because your lips shrink as you get old, tight skin, because our face falls from gravity. It takes seeing the jawline, so that means you have to do something with this. You either have to
grow a beard,
laser it, or grow a beard. I don't suggest that for women. So, but you can laser this with a Q-switch laser, which I just ordered, which pulls the skin up, and so that you get your jawline back.
And these things last for approximately how long?
It depends. It depends on what you're doing. The cheeks last about 9 months. Juvederm 6 to 9 months. That's here and lips. Botox is 4 months, but it's the least expensive of all. And the more you do Botox, usually the better you look after the Botox, because you're not getting grooves. Every time you frown, you can't frown and make a groove. So the wrinkles are progressively getting better because you can't frown. But you can use Botox all through the upper part of your face. You don't generally use it below. And then Juvederm and the fillers are usually in the mid-face and in the lips. And that's partially because the older you look, that's because your face drops down here.
Yes.
And so we're trying to pull it up and make more
hydrate,
of your face up
dry
here.
out, you get gaunt, you look desiccated. And that's naturally going to happen, but it doesn't have to happen.
No, it doesn't have to happen. And you can fight it one thing at a time. And I suggest going to someone who will give you a plan. And the plan could be over the next 5 years. And you can just do one thing at a time. I always tell people that they can either be really efficient, which is expensive.
Right.
Which means do everything all in the first month or two.
Right.
And look really good right away, but it's expensive. Or they can have a less expensive per month kind of one procedure here, another procedure there, jet peels to keep you hydrated and exfoliated. And then that's a much lower costing procedure. And you can do just a little bit at a time and keep yourself looking beautiful.
She does tell you that. She's also going to tell you that you can do these things and they are essentially cosmetic unless you also change your lifestyle. You got to look at smoking, you got to look at drinking, you got to look at obesity, you got to look at exercise.
And your hormones. And
your
you have to have
hormones.
hormones to really top it off, because hormones are what your skin needs to stay young looking.
So, thanks for listening.
Thank you. We'll see you again.
Email your questions or comments to podcast@biobalancehealth.com. You can find the BioBalance Healthcast on iTunes and on YouTube. For more information about bioidentical hormone pellet therapy and other reverse aging solutions, visit biobalancehealth.com or call 314-993-0963. Follow Dr. Maupin on Twitter @Dr. Kathy Maupin and on Facebook at facebook.com/biobalancehealth. Brett Newcomb can be found at brettnewcomb.com.